Okay, so the last bit we wanted to tell you about is just, so now that you've got your equity-focused systematic review and you want to disseminate your results, there are some additional knowledge translation questions you might want to think about in order to develop your knowledge translation plan. So the first is to think about what should be transferred. And so there is some evidence that summaries of systematic reviews or evidence products from systematic reviews may need to include additional sort of things like a patient decision aid or a policy brief or a structured summary, and that these products might be able to look beyond what works and also think about what works for who and why not, and what maybe the cost is. And so that would give you a chance to include some equity aspects like context. The second question is, to whom should research knowledge be transferred? And for equity-focused systematic reviews, you might want to think about different stakeholders and on how they would use your research. So we use a list of stakeholders that start with P's, but you could use any list of stakeholders. So for example, patients, providers, policymakers, product makers, the purchasers of healthcare, and the press. And you might want to think about how you would present the evidence differently for those different populations. The third question is, by whom should research knowledge be transferred? So to address health inequities, you might want to include different messengers who would have credibility with your target stakeholders. So they might be leaders from that community or somebody else who would be able to help get the message to the population of interest. The fourth question is, how should research knowledge be transferred? We've found that targeted and tailored messages are appropriate for transferring evidence about inequities, but you might also want to consider the barriers and facilitators. And the last question is, with what effect should research knowledge be transferred? So when you're developing a knowledge translation strategy for your systematic review, you might want to think about the use of evidence on inequities in policymaking, and you might want to think about how outcomes of importance would vary across different stakeholder groups. And so you want to consider that in your knowledge translation plan.
So knowledge transfer, KT, or dissemination and utilization, the generalizability, it's very important to apply scientific principles to it. It's not just fuzzy. There's a systematic approach to it, which has been developed by people like John Lavis and Jeremy Grimshaw and others. And so there's a systematic approach which can be used in the context of equity.